Hey everyone, we are going to continue the conversation about behavior change. And as Jessica sort of alluded to, we're going to start that conversation with pro sports. Clearly, Dave is a pro sport athlete.
Well, the truth is, I started a company that ultimately built the leading engagement platform in pro sports. And a lot of folks will say it's easy to do engagement in pro sports because the fans are already so passionate that you're halfway there. But the passion is really a double-edged sword. And a case in point is a time when I was at a Christmas party and somebody asked what I did for a living. At the time, I was working for the Portland Trail Blazers, and usually that would elicit a glowing response. Eyes would get big, and folks would really get excited. Not this time. This time, all I got back was, "Jailblazers? I wouldn't cross the street to piss on a jailblazer if they were on fire." Not the response I was expecting, and not what I think you're supposed to do in that situation. But I talked to the guy for a while, and I found out that he was a season ticket holder, and he had teenage sons. And so, of course, the team was misbehaving, and it was a bad impact on his family. So he didn't really fit into what we call a segment or a group. Back in that time, the status quo was to create 3 to 5 personas, and then we'd create a journey for each of those personas to engage them and bring them in. And so this user was a member of one of these personas. He was a season ticket holder, but we weren't really doing anything that engaged him, that really spoke to him, because the personas were too broad. So what we try to do is modify, shrink those personas until they get down to a size of 1. And the way that we do that is with data. We started by looking at the data we organically have access to. Ticketing is an obvious one. How many tickets somebody buy? How long have they been a season ticket holder? But then we tried to expand that to get metadata as well. So how are they buying tickets? Are they buying them online? Are they paying credit, cash? Are they buying early before they need to? These different things we can bring in and start to build a better model. Point of sale is another great way that we can look at different patterns. So looking at the sales data, we can see if there's any anomalous patterns that are emerging. Are they buying a lot of ice cream? Does that mean they have children? Are they buying a lot of beer? Does that mean they've got a lot of friends? The point is, we don't really need to answer those questions. We don't have to hit the bullseye. We can take those as clues and feed it into our models, and that way start to determine a view of that user that we can use to feed our engagement strategy. So once we have that platform built, we can start to surface these interactions to these users. The surprise and delight, setting goals, timelines, milestones, these types of things, but we can surface the right goal at the right time for that user. And this is a great way to affect behavior change. So if we're trying to get users to come to the event early, which is a popular one, we want people there 30 or 60 minutes before the doors open. It's a better user experience, it's less traffic. Of course, we can sell more concessions, more beer and ice cream. Do we need to sell a lot of the hot cocoa on a warm day so it doesn't all go bad? It's a great way that we can surprise and delight our users. And of course, everybody wants to make more money. This is a big thing, getting people to attend the game more often, buying more food, and renewing early.
So the technologies behind all of this we're very, very familiar with in our day-to-day lives, right? If you have an Apple Watch, if you have a Fitbit, you understand how those devices are giving you clues, are using the behavioral techniques that our last speaker was talking about. And again, we're very familiar with it if it's trying to lose weight or learning a language, or the credit card companies and the travel companies have been doing this forever. The question is, can any of that tech, can any of those consumer approaches work in our field? You know, as we know, we're a little bit of a slow-moving industry, but we think there is a real opportunity to take the lessons that have worked so well in the consumer world and apply it to clinical trials. We hear the term for this as engagement, mostly patient engagement. And again, we've been hearing about some of the techniques that get used. And when you look at a lot of companies and they talk about patient engagement, patient centricity, typically what they're talking about is notifications, right? And we heard that text messages can be a really good way to communicate with people. Unfortunately, the rest of the world has caught on to that. We all get more and more text messages from non-friends. We're getting it from a lot of political campaigns. And Unfortunately, I believe that SMS is becoming the next email. What we're really trying to get to here is not necessarily interacting with folks, but really engaging them. Does anybody in the audience want to take a crack at defining the difference between engagement and interaction? Yeah, please. Yep, so being two-sided is much more engagement versus interaction might just be one direction. Anybody else? Yeah. Absolutely, more emotional. And I think emotional in terms of the person is more involved, with that engagement. And if it were just interaction, maybe it's just a, external, I'm getting the 10% off of this product that I want for getting on an email list, right? Very, very transactional. Anybody else? I think the thing that we're getting to here is there are extrinsic motivators that I'm doing something and gain something in return, and I'll do it for a little while, but it's just an interaction between the two of them. And what we want to get to is actually intrinsic motivation, that I am involved in something because it is better for myself, it's better for the world, and I want to do this for my own deep belief reasons. And the good news about that is there are a number of engagement strategies, which Kate was just talking about, that we can employ on the tech side to help do that. And correct me if I'm wrong, Dave, but even in the pro sports world, you had lots of extrinsic motivators, right? You could get points and exchange them to, I think, wasn't the 49ers, you could do an auction and fly with a team to an away game?
Right, you can meet players, you could get better parking. There was all kinds of things that were sort of quid pro quo, tit for tat, and those are really extrinsic motivators. The intrinsic motivators are always more effective. And the good news is that we can't really do those reward type things in the compliance regulatory compliance industry that we're in anyway, but those are not the effective motivators. So here we see that we've got several options. For example, setting goals. So this is the ability to set your own goals and to attest that you plan to complete this goal. Here you can say, yes, I understand. And if you say, no, I don't understand, it sends a strong signal through the system. But the idea is that we really focus on autonomy, mastery, and purpose. And this is really contributing to autonomy.
I'm a recovering political activist, and we used to get people to commit to voting in the next election. And if you could get that commitment, somebody just sign it on a piece of paper, they're 5 times more likely to vote in the next election. So the setting goals can you see real ROI in terms of getting somebody to do something.
Very effective. And then the next one we have is overcoming challenges, and challenges can be a variety of different things. Common things to do here are setting milestones. So this is a very easy thing. Maybe the 3rd time you submit a daily diary, you've reached your 3rd milestone, and we can have some fanfare. We can have some little nudge or some little hit, some gratitude. We can say, thank you, you're doing a great job. We can also do things like real-time feedback. Real-time feedback is really important for engagement because it needs to be something that's happening quickly. Nobody wants to interact with a platform and then wait a day to understand if they're doing it correctly.
Well, and we heard from the film early this morning, I'm not getting any kind of feedback, much less a thank you. So this is a really, really big one.
Social proof is also really big. Nobody wants to eat at an empty restaurant, right? So knowing that there's more people here, that I'm contributing to something bigger than myself, really creates that sense of purpose that builds intrinsic motivation. And then finally, the transparent progress. As we also heard this morning, there's a lot of arduous things that we're asking people to do. And so we can show that they're halfway done. It's just a little chunking there, that mentally they know that they're making progress, they're almost through it, and that they're mastering the protocol.
No, absolutely, and that also speaks to that one-way communication side, right? Giving somebody ownership over the study that they're in. And again, this is really essentially what we were hearing in that very first video session, and we saw how emotional it can be and how important it is for really upping the adherence in the protocol and preventing that dropout. There's another benefit as well on the site side and on the coordinator side and on the sponsor side, is that as you are collecting more of this data, as you're understanding how people are interacting with the protocol, and you're getting all the data for the little pieces, how quickly they're responding to reminders, when a thank you message really motivates them to hit the next level, when it says, hey, you're 10%, only 10% more to get all the way to your goal, we know that works really well. Well, you can start to feed that data to the folks who are also running the trial. And what that does is it really allows them to understand exactly where all of their patients are at and start to identify, hey, is there a particular kind of patient that's having a harder time? Is there a site that's feeling more challenges? How can we use our limited resources to make sure that those patients who need the most help are actually getting that person-to-person touch? And this is a case where you can actually use tech to leverage your FTE for more human contact when it's necessary. All right. We have a little bit, because we only have a limited amount of time, we have a little bit of homework for everybody. We want to think about all of the consumer engagement techniques that are used on you in your daily life, and think and come and tell us why you think those won't work in the clinical trial space. So find me, find Dave, find both of us, and say, this is not going to work because blank, right? We really want to know. And for every idea that you give us why it won't work, please couple it with an example of why you think it will work. And we really, really look forward to having those conversations over the next 12, 24 hours. Thank you, everybody.
Thank you.